Welcome back. You're still watching The Globe. Now, the president of Brazil, Jair Bolsonaro, has tested positive for COVID-19. Bolsonaro announced his positive result during a media address in the country's capital, and he now becomes one of the 1.6 million people who've tested positive in the country. In the last couple of months, Bolsonaro had been downplaying the impact of COVID-19, even as Brazil registered over 66,000 deaths from the virus. The country's health system is under severe pressure. At the start of the country's peak in infections, Brazil made headlines for digging mass graves in anticipation for COVID-19 related deaths. 1 million people have recovered from the COVID-19 virus in the country. The WHO has wished Bolsonaro a speedy recovery. Well, Brazil and the rest of Latin America have been brutally ravaged by COVID-19, as you've been hearing. Brazil, the world's sixth biggest nation with more than 210 million people, is one of the outbreak's most lethal hotspots. More than 65,000 Brazilians have died from COVID-19 and over 1.5 million have been infected. The figures are rising, and journalist Thomaz Favaro is in Sao Paolo, keeping a close eye on events in the country for us, and he joins us now via Skype. Thanks so much for joining us. Always good to talk to you. I hope you're keeping safe.
Thank you very much, Pete. Always a pleasure to be here.
So Sao Paulo has been one of the epicenters. Is it still the worst affected?
In total numbers of cases, yes, it remains the, I would say, the hotspot within the country. But we have seen some interesting trends lately of the number of cases actually reaching a plateau and beginning to decline in Brazil specifically, in Sao Paulo specifically, and across major urban centers, particularly the state capitals. But the total number of cases in the country remains on a steady ascension curve, largely because of an increase elsewhere in the country, particularly in the countryside.
All right. Has there been any explanation given why the countryside is now seeing more and more cases? Is this movement of people, perhaps from urban areas, from the cities?
Yes, I think that's partially true, and it's partially the fact that the virus has spread initially across the major urban centers. These were the initial hotspots, and now they're beginning to recover or contain some of the worst affected areas. You know, this is the chance of the virus getting to spread elsewhere in the country, particularly because in most of the country there isn't a mandatory lockdown. People are still allowed to travel freely and move from one state to another, and from the major urban centers to smaller towns across the country.
So, an interesting twist to this tale. He's been calling this a flu-like condition, but the president has tested positive. What has that done, do you think, to his stance, and how have people been reacting?
So I think when we look at the government's response towards the pandemic, I don't think the president's positive diagnosis will impact that. If you look at how the president has announced that to the media and the press, you know, when he was announcing the exam results in a press conference, it's very clear to see that he was reiterating most of the arguments that have guided his administration's response to date. So on one hand, downplaying the severity of the illness, on the other hand, opposing social distancing measures that were implemented by mayors and governors, and third, further recommending the use of a particular drug called chloroquine that the Brazilian government and his administration in particular has been particularly keen on putting forward as a suggested treatment for COVID-19 patients.
What about the public? I mean, you know, when somebody as high profile and as key as that gets COVID-19, I guess the story becomes very real.
Yes, but I think for most of Brazilians, I think that alarm bell rang a while ago. I mean, Brazil's been reaching the global headlines for quite some time now. So I think it's not a diagnosis that will significantly change how people perceive that threat, because most of them had, again, like I mentioned, the alarm bells ringing for quite some time. But this is can actually be quite an interesting change from how the public perceives Bolsonaro, because this now obviously, he's battling a disease, and this is partially shifting that attention or spotlight on himself as a policymaker and refocusing instead on his individual drama as another victim of the pandemic. And I think this is in many ways a much better position for Bolsonaro politically, certainly not from a health perspective, but politically, considering that he has struggled to present himself as an efficient policymaker because of the poor results that his administration have delivered so far with regard to the pandemic.
I know that he's been keen to get business to run as quickly as possible and ease lockdowns as quickly as possible. With this surge that you're seeing in other areas now, is the government talking about perhaps slowing that down, or are they still trying to march as quickly as they can towards opening up the country as fully as they can?
It's certainly a balancing act that most policymakers are having to handle at the moment. I mean, even though, as I mentioned earlier, there hasn't been a mandatory, strict lockdown in many other parts of the world, such as in South Africa, people were, still to some degree voluntarily adhering to the quarantine, and many people did decide to stay at home during most of the past, 3 to 4 months. So you do have a situation whereby there's a lot of fatigue around, how much further the population needs to handle with this. And this is creating, I think, stronger pressure for a faster reopening. We can see that, for example, in Sao Paolo, where bars and restaurants were allowed to reopen as of yesterday. And it's generating, obviously, concerns, particularly among health experts. To what degree is this has a potential to, stop the plateau that some of these urban centers have been able to achieve over the past few weeks. We have precedent from other places, particularly the US, but not exclusively, where, an attempt to reopen too soon proved to have quite dreadful consequences for the health sector in general.
Has the government been working hard to try and prop up a lot of parts of the economy by subsidizing and giving money to people who perhaps lost their jobs and businesses that have had to shut down? Has there been that kind of injection into the businesses and people that have been affected by COVID-19?
Absolutely. Brazil's fiscal stimulus plan, if you look at a proportion of GDP, has been probably one of the most aggressive, certainly within Latin America. You have the government providing sort of monthly stipends to almost a quarter of the population has requested, but not as many are receiving, but to millions of citizens are receiving sort of a monthly stipend from the government, and have been doing that for the past 3 months, and the government has already indicated that it plans to renew that, and businesses have been able to I think to cope with the situation with some degree of government support in the form of additional credit or tax benefits and other types of support. But even though or perhaps put it differently, despite this fiscal stimulus, is still, the pandemic brought the economy such a grinding halt that, most GDP forecasts for Brazil are still quite pessimistic, anywhere between a reduction of 6% of GDP to, I think some of the most dramatic ones, edging closer to a 10% drop of GDP in a single year.
All right, so that's the economy, and of course what that means is that the average man on the street is really struggling. How are they coping? And I'm thinking here in terms of getting medical care.
Yes, so that's certainly another concern that we have been seeing and voiced, by citizens, businesses, and public officials is around the availability of hospital beds, in particular intensive care units. A number of states, the majority of states are, reporting that they have some of these their availability close to full capacity, or certainly above I think worrisome levels like 80%. So it's definitely a concern, but one that does vary significantly across the country. So you still see areas in the country which are trying to reopen the economy precisely because they do have that spare capacity on the health front to potentially absorb an increase in infections. But this again varies widely within the country.
All right, so perhaps to close, what is likely to come out of the mouth of the president in the coming days? Will it be business as usual, even though he'll be in quarantine?
Yes, I think so. Like I said earlier, I think from the outset when he was announcing, the results of his COVID-19 exam, he made clear that he was going to reiterate the arguments that have underpinned or guided his administration's response to the pandemic. So it's very difficult to foresee any change in the government's response towards COVID-19 solely on the back of that exam result.
All right, and that's where we'll leave it. Thank you so much. Always good to talk to you. Thanks for your update there, Thomaz Favaro, speaking to us from Sao Paolo in Brazil.
Likewise, thank you very much, Pete.
Adeus.